I'm Leslyn Keith with Lymphatic Lifestyle Solutions Online, and I'm here to tell you about a few of the results that we've seen in using this program for our patients in our clinics. So let me share this with you. Just a few of the results that I've seen. Many of you have already seen my presentation about the current research about lymphedema and weight loss and using a ketogenic diet. So you might have already seen this from the study that I conducted in 2015 and was published in American Journal of Lifestyle Medicine in 2017. And so I had a group of 10 participants that that came to a lifestyle group, basically our Lymphatic Lifestyle Solutions course. And 4 of them did not use a ketogenic diet, and they're depicted in red, and 6 did use a ketogenic diet. And so you've probably seen this before, where we did 3 times, we measured their weight before we started the study. This is the 4 people who didn't use the diet. And then we started the study. We used the Lymphatic Lifestyle Solutions course, and then we measured again after that course ended, and then we measured again 30 days later to see how they maintained. And that group averaged a weight loss of 1.36 pounds, or less, just a little over a half of a kilogram. And then in the group that chose to use a ketogenic diet, so here's our 3 weight measures prior to the intervention, very stable weight, and then after the intervention was completed, and then 30 days later. And so they lost over 18 pounds or 8 kilograms of weight, which is 8% of baseline. So you can see that it was substantially more in those that chose to use a ketogenic diet. And this was basically the Lymphatic Lifestyle Solutions program that they went through. And there was a wonderful correlation with weight loss and limb volume reduction. Essentially, the more weight they lost, the more that their swelling went down. So that was a very, very nice outcome of this study. And then just looking at quality of life, because we know that there's a lot of quality of life issues associated with your lymphedema. And so if we can reduce your weight, reduce your lymphedema, it really has an impact on your life. And so we use this particular self-report survey, the lymphedema life impact scale. And so essentially, the more that the impact of lymphedema went down, the better their life was, the better their quality of life was. And so here in blue, we have the participants that used the ketogenic diet, and you can see that the impact of lymphedema went down tremendously. 2 people, over 35 for 2 people, everybody went down. In the non-ketogenic diet group, 2 people, their impact, their lymphedema actually increased, and the other 2 went down very, very slightly. So you can see a big difference even in quality of life when we use a ketogenic way of eating. Let's look at a couple individuals. And so here is a case study of a gentleman. When I first met him, he was 56 years old. He actually was obese prior to this horrific motorcycle accident that he had. So he weighed 250 pounds prior to the accident. So he had a BMI of 34.9, which is anything over 30 is considered obese. So he had that severe back and knee injury in 1994 and had severe chronic pain. So he couldn't move, he couldn't exercise, and he continued to gain weight, and mostly because of the way he was eating. And so what I'm going to describe to you, what happened with this gentleman is that he still was not exercising. All he did was change the way he ate. But to adopt this way of eating sometimes is tremendously a challenge for someone. To go against everything that they have been taught is healthy eating and change to a ketogenic diet was difficult for him. And from 2011 until 2013, I was talking to him about it, but he chose not to use this way of eating. And during that time, his swelling increased. He got repeated infections. He was hospitalized. He actually suffered respiratory arrest. He had to go on home health, and his weight increased to a high of 514 pounds. So a tremendous weight increase. And I will say that probably almost 100 pounds of that was probably water weight. Because in 2014, his weight was back down to 443 pounds, just because he was now no longer in the hospital and he lost a lot of that inflammation, a lot of that water weight. And at this point in 2014, he decided he wanted to use the ketogenic way of eating. And so we did that for 10 weeks. Our program that we work with you is for 12 weeks, so you get a little bit longer. And so his weight reduced in that time almost 40 pounds. And so his BMI went dramatically. So at this point, he's still obese. He has not exercised. All he's done is change the way he's eating. And he had a huge volume reduction in his leg. And this is without treatment. This is without doing our traditional complete decongestive therapy. We're doing manual lymph drainage. We're doing compression bandaging. We're doing remedial exercise and skincare. All he had during this time is that he was wearing compression garments. He had to continually get new sized custom garments because his legs were getting so much smaller. So 40 pounds decrease, less than 40 pounds decrease, and his legs reduced in size tremendously. Here's another person, and she, when I met her, she was 62, and she just had a gradual increase of her weight over the years. In 2014, she really didn't know how much she weighed. She guessed it was about 400 pounds, but she had not weighed herself for the last decade. And so she really wasn't sure how much she weighed. And so if she was 400 pounds, we put her BMI of almost 61. And she did have, just because of her obesity, she had mild swelling in her lower legs, and her knees really, really hurt. Many of you might have had that happen to yourself. You know, the more you weigh, the knee pain really increases. And so I suggested she use a ketogenic diet, and she started doing that prior to having this doctor's visit. And she implemented it between June and August. Then she went to go see her doctor, and she got weighed. And so she finally had a definitive starting point of 342 pounds. And so by September, she continued on that way of eating, and she was down to 325. So this start in June, maybe it wasn't as high as 400, but it certainly was more than 342, because in that 2 months, she had already lost some weight, and she was down to 325 in September, and her knee pain was decreased. That was huge, and very much a motivator for her to want to continue. And so then by February the next year, she was down to 290. And let me tell you, it's a nice milestone when you break the 300 mark. And so she was really doing very, very well and was very happy. And her legs, the reduction in the swelling went down dramatically. Matter of fact, there wasn't any swelling any longer in her lower legs. She still had some knee pain and some swelling in her knees, probably from arthritic changes and knee damage from her weight. But the swelling was pretty much resolved in 7 months. Pretty spectacular for her. And then by July, she was down to 273. And so at that point, as her doctor said, you cannot have knee surgery unless you lose 100 pounds. And she was pretty despondent because she had tried over the last decades and had never been able to lose that kind of weight. But at that point, in July, after a year of using a ketogenic diet, she had what the doctor believed to be at least 100-pound weight loss. And so she was eligible to have her surgery, her knee surgery, in November 2015. And so, a very, very good outcome for her. She was very, very pleased. And then here's another gentleman. And when I met him, he was 64, and he had been born with primary lymphedema. So he had an impairment of his lymphatic system at birth, and he had never been treated for it in his entire life. But he had worn special clothes and special shoes to accommodate his legs. that were both quite large and quite swollen. But he also was overweight. He was actually obese with a BMI of 41.3. At this point, he did not have insurance, but he was 64, and in 6 months, he was turning 65, and he was going to have Medicare. And so he wanted to come back to the clinic and have treatment at that time. And so I said, well, in the meantime, here's a handout. Try a ketogenic diet. That's seriously the only guidance I gave him. You will have much, much more when you're taking the course. But I gave him the handout, and he chose to implement a ketogenic diet with the guidance of his doctor to make sure it was safe for him. And so that he started that in February. So remember, I saw him in December. He did not want to do anything to disrupt the holidays, and he wanted to wait till after Valentine's Day before he adopted this way of eating. I mean, it's hard to, you're thinking about, I'm not going to be able to have all these traditional desserts and sweet foods, and so I'm going to feel deprived, and so it's hard to start. But he eventually did start in February of 2015. So remember, he started out here in December at just under 300 pounds. And so he came back for his initial eval when he got on Medicare in May of 2015, and now he's already down to 255. So he lost quite a bit of weight, 40 pounds, pretty much on his own by adopting a ketogenic diet. But what was even more amazing is what it had done to the volume of swelling in his legs. And when you look at these numbers, I don't know if you have had treatment or not, and you know how much this is an incredible amount of fluid loss. I would have been pleased if I had seen him daily for complete decongestive therapy with MLD and bandaging and everything. And I saw him daily for 3 weeks. I would have been thrilled to get this much of a volume loss, of a size loss in his swollen legs. He did this merely with how he ate. And this really proved to me that this is a spectacular way of eating for someone with lymphedema. And then, of course, he's down by October 2015, he was down to 225. And I'm still in contact with him today. He's able to maintain that weight loss. Let's have a little bit of pictures here. And this is actually someone that has gone through the Lymphatic Lifestyle Solutions course. And at this time that I was working with her, she was 71 years old. She was active as a gardener and a grandmother. She had lipedema, she had depression, and she had a gradual weight gain in her lower body mostly, severe chronic pain, severe fatigue, brain fog, and she really felt like she was ready for a wheelchair. So at this point, she said, I'm willing to try anything. And so she was ready to try the Lymphatic Lifestyle Solutions course. And so she went through that course, and this was in 2017. And she the weight loss was 232 to 186 pounds, which she thought was wonderful because she had not been able to lose that much weight before. But it's amazing that the weight loss was the least of her wonderful results, because her tremendous severe pain was completely resolved. And that resolved within the first month and a half to 2 months. It happened very, very rapidly. We're finding there is something with the ketogenic way of eating, particularly with the ketones, that help modulate pain. And the restriction of carbohydrates that takes away inflammation that can cause pain. So that was a spectacular result. But her energy level improved. So she was back to gardening 3 to 4 hours a day, walking on the beach with her husband. Her brain fog lifted, and the way she knew that it lifted was that she went to an airport to fly somewhere on her own, and she was able to navigate her way from one gate to the other. And previously she was completely confused in the airport, and this she was able to do on her own. It was pretty spectacular. And her physician, who was also monitoring her, on this way of eating, wanted to make sure that her blood levels were good, and all of her blood panel was excellent. Her triglycerides were low. She had a moderate level of HDL, which is considered your good cholesterol, and her coronary artery calcium score, which is a good predictor of your cardiovascular disease risk. It was 0, and that's pretty spectacular to have a 0 score for someone at her age. Anything above 500 or so, you're starting to worry about a risk. And I've had patients that were up in the 2000s. She was 0. So her physician was very, very pleased at how she was doing and told her to continue this way of eating. And you can see the spectacular results that she has. She really, you can see how she slimmed down. But I have to say that for her, it was the most amazing thing was how she felt. So I hope that this was useful to you in seeing how the kind of results that you can have when you go through our program. We look forward to seeing you there. Thank you.